Hi, Tony and Yomi. So great to see you today. Talking about a topic that is quite timely given the beginning of summer and Memorial Day weekend here. Tony, I was hoping you could tell us a little bit more about the U.S. National Water Safety Action Plan and how that came about.
Yeah, thanks for asking that, Joyce. It took a 4-year period to develop, and it was a little slower than the whole work group committee, steering committee wanted to have happen. Pandemic, and then just the sheer complexity. And part of it is, the United States with 50 independent states and the 14 territories, DC, 30,000 counties, and every type of water from, Alaska to Hawaii and Florida. There's just a lot of very challenging dynamics to develop a national plan. Most developed countries have a national plan, so it's great that we're getting there. There were 27 Blue Ribbon panel members, 80 plus subject matter experts consulted, 175 organizations participated and contributed to the plan. And there's it's really great to see the release of this coming out later in June, and we believe it's going to help address a lot of the disparity and inequities that have occurred in water safety, plus just the challenges that we've got to address. So it's been a pleasure to be part of the development of that work group, and I just couldn't be more proud of the leadership that helped get us there. Yomi, I got to say this too. I was a part of the data and surveillance work group, and Dr. Tim Flood out of Arizona, who's been a longtime researcher, and we were led by Dr. Julie Gilchrist, Bill Ramos, and Dr. Kwan as well here, all very published and well versed in it. But I think about the Arizona work, and 30 years ago or plus, when we started our local drowning prevention coalition, Arizona was working so hard on drowning prevention, and they had developed a thing called April Pools Day, and they trained 41,000 people in Sun Devil Stadium on CPR. And so we asked, back in the old days, we got on the phone and asked the leads if we could borrow that name. And, we've been conducting an April Pools Day event in April at our pools that has led to a lot of prevention efforts. So I know Arizona has just been an all-star when it comes to this work. So what's going on there lately?
Yeah, so thank you. Dr. Flood has been a tremendous resource and a big advocate for drowning prevention, who recently retired. So we're really sad to see him leave, but the work still continues. It's funny you mentioned 30 years ago, because back then, when our drowning was probably at one of its highest points. I mean, there was about 64 drownings per 1,000 children. That's just children. And we've been able to reduce that number to about 8 per 1,000, which is still a lot, but we are definitely better than when we were. We still continue to do April Pools Day. We have a lot of different partners at the table. The Drowning Prevention Coalition of Arizona is one of the leaders within the state, which we are members of and work with. But we also have other folks that are doing work. So a lot of our Safe Kids coalitions are doing work as well. I want to highlight Jessica Mitchell from Safe Kids Pima County does a water safety for you program, where she partners with several different schools within the area, and they do activities within the classroom to teach them about water safety, which then leads to an end of the year, like graduation, if you will. And there they bring 850 students to one location where they do spend the day, like reach your throat and other activities on how to help with those activities as far as drowning prevention. We also have our other Safe Kids coalitions around the state that are partnering with, like, our electric company, which we have here called SRP, where they're providing water or gated gates for people who don't have that barrier around the pool. So they apply for like a grant. There are some income requirements. And they have to have a child who's at least 6 years or younger living within the home. That's just within the Maricopa area. But we are certainly still working with the Arizona Game and Fish, providing life jackets and providing those so that people can use them when they're in the open water scenarios. So there's still a lot of movement, a lot of things that we're still doing within Arizona. So we're really fortunate that we have great partners at the table to be able to do that. And so, we're very lucky, I guess. And, drownings happen everywhere, as you all both know. It can, it's just not in the bathtub, but in the pool, open water. We have a lot of rivers and lakes here. And with the Memorial Weekend coming, it's, you just don't know. So you got to be prepared, right? So that's kind of what we're working on in a nutshell. So that's what's happening in Arizona. But Joyce, can you tell me about the work that the governor in New York is doing? I understand that she has a commission to prevent childhood drownings in Arizona or in New York. So can you share a little bit about that?
Certainly. In New York, the Temporary Commission for the Prevention of Drowning was formed in response to legislation that was proposed by Assemblywoman Stacey Pfeiffer Amato. So there are five areas for the commission: develop age-appropriate and developmental appropriate standards when kids can become properly trained for water and swimming instructions, and then to also incentivize parents and guardians to enroll their children in water safety and swimming instruction, as well as develop a plan to engage public and private partnerships, and to develop an implementation plan for swimming safety programs to make sure that those are available in underserved communities, and then develop a comprehensive public awareness campaign to ensure parents and guardians receive information on the importance of children receiving basic water safety. One of the exciting aspects of that portion and the pending legislation that is still to be passed is that there are plans to produce a video that will be shown, a short video that will be shown to new parents while they're still in the hospital, along with the shaken baby syndrome, to prevent some of the early under 1 age bathtub drownings. Hi, Tony. I just had another question pop in. I was curious about, I know that you're being guided now, your National Action Plan, by a steering committee, and that you're also going to have working groups that will help, I guess, implement this plan. Can you tell us a little bit more about the working groups that you want to engage the public in, particularly whether they are organized by age, by topic, by age, equity, place of drowning?
Yeah, the plan was actually developed with these various working groups, and so that'll be the different chapters and parts of the plan. So there was, we in public health, there was a good data and public health surveillance work group that actually included bridging. We had Dr. Tessa Clemens from CDC on that, and a couple others of us that had been part of the Safe States National Association of State and Voting Law Administrators work group to look at boating related injuries and fatalities and the different surveillance systems they used, and how can we marry those two, as well as everything from child fatality review to just all the different sources of data, including cost burden, because I think the boating community have been underselling the importance of the burden related to drowning there. I think 2020 CDC estimated about $53 billion a year in water safety drowning related. There was also a work group on water safety and water competency and swim lessons. How do you define that? There was a supervision lifeguarding work group. Again, these were, national leaders from YMCA and the different lifeguarding groups, and then a rescue CPR. We're very strong in this country on that component. Pool fencing, four-sided fencing, on the public pool regulations, that's led to significant reductions in drowning, and it sure helped a lot of the private pool, backyard pool situations. And there was kind of going from that to the whole open water or natural waters area. Life jackets and personal flotation devices was another component. And it kind of reminds me of this whole comprehensive effort. We did a paper, Dr. Linda Kwan and I, with one of the Columbia University students a number of years ago, actually not that long ago, that showed states like New York. So it was interesting to hear the governor's work there. States that have strong water swim beach guidelines and rules and regulations have less drowning than states like ours, where we don't have all those components. And so there's certainly things there. So there's going to be input opportunities through the Water Safety USA .org efforts. And while, you know, it was hard to incorporate everybody's input into the plan, I think it's going to be kind of broad enough and specific enough to be of use to anybody anywhere. And then, you know, we got to marry that up with the federal legislation. We've been asking for $5 million through various advocacy efforts to fund national water safety, and it's been funded at about the $2 million level. So hopefully we'll continue to see Congress and the president continue to support water safety nationally.
How would you recommend that injury control research centers or others working in public health and in injury prevention engage with the working group?
You know, and actually, our Harborview Injury Prevention and Research Center is helping our Mayor Bruce Harrell with a Seattle swim effort, and it's an evaluation in the swim lessons, the most underserved in our community, and we're going to see kind of pre and post. So I think that that's an important part, is the injury centers can help with that data gathering, that evaluation, and long-term tracking. I think that's one important role, and being evidence-based, you know, as we continue to build the evidence base around water safety overall.
This is exciting developments. I look forward to us engaging additionally in the future. Thank you so much.